Good afternoon. I'm Representative Cary Smith from House District 55 in Billings, and we really are excited about what we're doing with health care reform in Montana. As was mentioned earlier, you do hear and see in the newspaper a lot of the stuff about kind of the fringe type bills we're carrying, the kind of the off the wall type bills, but you've listened to a couple of the senators here speaking about bills they've got going through the Senate. On the House side, we've got 19 bills that deal with health care reform. That's 19 bills, that's a lot. 8 of those bills are mine. We've got quite a few that are Representative McLaren's, and we've got Champ's bill out there, and we've also got bills that are being carried by people that aren't here. So in my 10 minutes, I'm going to try to go through what I've got and what we have out there for a lot of other folks as well. Probably one of the things that we hear all the time when we talk about health care reform, we've got to do 2 things, and why didn't the federal government do this? We've got to be able to buy insurance across state lines, and we've got to do something about tort reform. Well, you heard a little bit about tort reform. I'll go into some more detail on that, but the first bill I want to talk about is House Bill 445, which allows you to buy insurance across state lines. Now that really isn't a new concept. We already can do that, but the problem is if you buy an insurance policy from a foreign insurance company, meaning something outside of the state of Montana, you have to comply with all of the mandates that we have in Montana, all the rules, all the regulations. And as was mentioned earlier, we have a lot of rules and regulations and mandates in Montana that make the health care quite expensive. So buying insurance across the state lines is one of the vehicles to do that. There is currently only one other state that has passed legislation to do that, and that's the state of Wyoming. So this is something that's just starting to catch on right now, but we feel will provide a real opportunity for taking and lowering the cost of insurance. The number of choices that you have just moving from Montana to another state is just almost unbelievable. Lots and lots more choices. The next bill I want to talk about is House Bill 183, and what a lot of these bills do, they are designed to take and insure the segment of our population that's the most difficult to insure right now. If you belong to a group policy or you have health insurance through your school or through the state or any kind of a government agency, those people are pretty happy about that. And you have a lot of folks that are working on keeping the health costs low for you. But the segment of the population that just doesn't have anybody really watching out for them is somebody that's trying to buy an insurance policy on their own. And one of the reasons why I decided to become involved with this insurance situation, I worked for Sears for 32 years. When I retired, they told me, well, we're not going to be able to cover any of the expenses for your group health policy, but don't worry about it. You'll be able to get the same great policy, and all you'll have to do is pay the premium yourself out of pocket. And this was about 5 years ago. For me and my wife, our premiums are going to be $1,200 a month. So I figured out, that's something we can't afford in our budget. I'm a retired guy now. So we looked at the high deductibles, and the high deductibles were just about half the cost of a standard insurance policy. So a lot of these things that we're talking about here are designed to make high deductibles more attractive to individuals. House Bill 183 takes and provides cost savings by one of the first things we do that's not very exciting for the state auditor is we take the 2.75% premium tax and we leave it in the policy for a reduction. That 2.75 policy goes to pay CHIPS, it goes to pay for Insure Montana, it goes for the social programs. We think we're better off if we leave that with the individual to pay for their own insurance rather than trying to socialize it. The bill also takes in and deals with if an employer wants to take and set up an account where they're going to take and pay for some of your out-of-pocket medical expenses as a benefit to the employee, that's not considered as income. So that's another way for the employer to help. We've got a benefit in there that allows you to get a deduction for each person that you sign up for one of these programs. We've got benefits in that bill that make it so that if you're living a healthy lifestyle, if you're doing your exercising, your weight's under control, you're a non-drinker, you're a non-smoker, we don't consider that as an unfair business practice to give a person a break on that. Believe it or not, we have to pass a law that says that's not an unfair business practice to take care of your own lifestyle. A little strange to me. The next bill I want to talk about is House Bill 184. Again, this is designed for the person that's buying insurance on their own. If you participate to a group plan, your employer gets to deduct the premiums from their profit. But if you're trying to buy insurance on your own, you're paying out of your pocket. So this bill takes and makes it so that your the premiums that you pay and your out-of-pocket expenses are a 7% tax credit on your state income tax. Right now you can file for tax deductions, but they reduce your gross income, so this bill's quite a bit better on that. I have a bill that's similar to the one that Senator Priest talked about. It reviews the health care mandates. Montana has about 40 mandates, I believe, right now. A neighbor state, Idaho, has 13. So again, a reason for out-of-state insurance is if you buy insurance from Idaho, it's going to cost you less. But we can also take and address the problem in Montana by reviewing the mandates. What my bill does is takes those mandates, and before we can make it law, there has to be an actuary provided by the state auditor to see what the cost-benefit of this is. Now, interestingly enough, when we were debating the bill on the floor, we had from the other side of the aisle a professor that is in economics, and he says, I don't understand this. Of course we can't do this. The insurance companies have already decided that these mandates aren't cost-effective, so that's why we have to mandate them. And you're thinking, and this guy's teaching economics, okay? As we talked further about that bill, he said, well, what is cost-effective? And so I'm talking to an economist. I mean, he ought to understand what we're talking about. So I tried to make it real simple. If we've got a mandate out there that only affects 5 people in the entire state, but it raises the cost of the premium between 1% and 3% for everybody out there, that's not cost-effective. His answer was, well, how can you place a value on the life of a person? Folks, we do that all the time, you know. And if you're going to not take and place a value on that, you can't pay off on any death benefits, you can't have life insurance, you can't have any of those policies out there we talk about. So, you know, it's an interesting conversation. We have mandates in the state that would require that every policy that you have provide coverage for an acupuncturist. Now, acupuncture may be great. I'm probably never going to use that benefit. My wife and I are in our 60s. We have to have in vitro fertilization on our health insurance policies if we buy it separate. So, you know, you got to be able to buy what's necessary for you, not what somebody else has decided that's good for you. Now, another problem with Obamacare is if you look at the state auditor's bill that would take in and create the exchange, that exchange really grows government. It's got an advisory committee on it, it's got a board. I can guarantee you that advisory committee and the board is going to be made up of special interest groups that know what's right for us, and the mandates we have now are just going to get bigger and bigger and bigger. And by the way, if we do want to do this all on our own, as Senator Priest mentioned, we do have that latitude. We can make it more inclusive and more expensive than the federal government. Not much choice. Another interesting bill I have, and this is actually a provision in Obamacare, but this is a good free market provision that I think is really an exciting idea. If you're a Muslim, if you're Amish, or you belong to a health care sharing ministry, you're exempt from the mandate. Now, I know what Muslims are, I know what the Amish are, but I didn't know what a health care sharing mandate or a health care sharing ministry was. So I took a look at that, and a health care sharing ministry is a group of people with a similar belief, Christians, that have decided to share the expense of their health care costs. Believe it or not, in the state of Montana, we want to look at that as insurance. It's unclear. So my bill clearly says that this is not insurance, that you can have faith in your fellow Christians and God to take care of your medical expenses and share on the expense. Healthcare sharing ministries, they're not really premiums, but typically what you would spend is about a third of what you'd spend for a regular insurance policy. That bill has already gone over to the Senate, and I think we're going to hear it on Friday in Senator Priest's committee. What's really interesting is that this is an exemption to the mandate. It is part of Obamacare. We didn't have any Democrats vote for it in the House. I hope we do better in the Senate. I've got a companion bill that goes along with it that would also take and give you a tax deduction for what you're paying into for your expenses for the healthcare sharing ministry. We don't call them premiums, but right now it's just looked at as a gift. So you can't take a tax deduction on it. We would look at it as a tax deduction. I also had some of the folks from the other side of the aisle saying, well, that's kind of unusual. We don't allow that anywhere. And I says, well, I don't know. I get to deduct my tithing. So, you know, there's just a really difference in the way we look at issues from across the aisle. We've got a bill being carried by Representative Flynn that would take and, again with the high deductible idea, make it possible for a state employee to participate in a high deductible with a health savings account. Representative Flynn has taken a look at Indiana, I think, and once these types of policies were presented, about 70% of the people that are state employees have signed up for these. And as I mentioned, high deductibles with health savings accounts are much cheaper than a traditional plan. We, on our tort reform, I've got a bill that would take and change the amount of time that you have to file for a medical liability. It looks like don't I get to take some of their time? Oh, I already did. Okay. We've got 7 tort reform bills that deal from, and probably one of the most exciting one is we hear about the preventive medicine that takes place all the time out there. And Janet Taylor has a bill that says that if a doctor is doing what's prudent and reasonable, even though he didn't provide every test that's absolutely available, they won't be liable. We've got a bill that'll make it easier to recruit pediatricians and geriatric doctors. I think that's probably important for most of this crowd out here. In Montana, we can't attract good physicians because of the high medical malpractice insurance. And that's probably where I ought to stop. But anyway, we are doing a lot of stuff. We're not just doing the stuff you read about in the paper.